pointer, the All right, everybody, we're going to go ahead and get started. I hope everybody had a nice break. All right, let's go ahead and take our seats. We're going to get started with the next session here. From the Ohio State University and my homeland, Dr. Marina Bellatrini, right? We'll be talking about TTP and stroke, which is one of the emerging areas we're looking at. Now that patients are living longer, it's about the long-term impact of the disease.
Good morning again, everybody. If you just walked into the room, I'm Marina Beltram. I'm one of the adult hematologists at Ohio State. And I am going to talk now more about the long term, what happens to people after they survived their acute TTP episodes. And now that over 95% of them are surviving these dreadful events, we get to observe what happens and see what else we can do to get people back to being healthy and doing well in their lives. So I want to thank Leanne for giving an amazing talk before, because now, if you listen to her talk, we're all TTP experts, and I can go straight into what matters for this conversation. So the brain is one of the known targets of an acute TTP episode. Going back to that pentad that was described earlier, the kind of classic features of TTP include bruising, the anemia, the fever, the kidney injury, but prominently the confusion, and that sometimes evolves into coma, and oftentimes also is associated with strokes, a part of the acute TTP presentation. So, what exactly is a stroke? What exactly are we talking about? So let's set some premises here. Every organ in our body needs oxygen to be able to produce energy and function properly. And one of the most common reasons for why we lack oxygen is because there is a blood clot that is interrupting the blood flow and interrupting the supply of oxygen to the tissues, to the organs. So a blood clot, the fancy name that we give for it is a thrombus, as in thrombotic thrombocytopenic purpura. And the brain is a highly active tissue. It means a lot of oxygen. Maybe you think for some people it may not be true, but um, because it's so highly active, it's also very susceptible when there are interruptions to the supply of oxygen. And then that leads to brain tissue death of neurons. And then when these neurons start dying, depending on where in the brain they are, that's what's going to dictate the symptoms of what this stroke is going to be looking like. So basically, it's brain tissue death. It's a stroke. So I think it's important that we talk about what a stroke is and how we recognize it, because time is brain. So promptly recognizing when a person may be experiencing stroke is one of the number one factors in how well this person is going to do after this episode. So the acronym is B FAST, okay? So strokes can present with people having balance problems. They may feel unsteady, not being able to walk properly or move their hands as they would. They may have problems with their eyesight, so sometimes it's a whole, like half of the field of vision that goes by the wayside. And then there are some things that might be a little bit easier for other people to notice. So face drooping, like half of the face looks a little bit different. You ask people to give you a smile, and if you go like this, that's not a good sign. And then you ask them, please raise your arms, and then they are able to move one side much better than the other one. They have speech problems, so you're trying to talk to them, and they're either not able to talk, their speech sounds very slurred, or you're like talking nonsense. That can be also a symptoms. And if you notice these problems, then it's time to call 911, because time is brain. I also want to point out that not everybody reads the textbooks and not everybody presents the same way. So there may be some variations around these themes. And these atypical symptoms are especially common in women, which I think it's important for us to point out. So things that people may also report are headaches, generalized weakness, not being able to concentrate or focus, or changing their thinking, hiccups, nausea, chest pain, fatigue, shortness of breath. So there may be more than just the brain symptoms involved. So let's go back to the relationship between stroke and TTP. We already established that stroke can happen in acute episodes of TTP. They are actually also very common presentations for people who turned out to have congenital TTP. So if in both of these conditions we see strokes, then the problem must be the low ADAM-TS13, right? Right? Well, yes, at least partially. So it's there is some very provocative data that some researchers look at the whole, like a big number of people that just live out in their normal lives. They don't have a diagnosis of TTP, and they notice that those who develop strokes tend to run lower levels of ADAM-TS13 levels, like around 70%. Okay, nothing that would make anybody concerned about TTP, but yet there's already some relationship that even without the diagnosis of TTP. So Adam test 13 is clearly important. And for people who survive the acute TTP episodes, we've also learned that Adam test 13 is also important in the recovery phase and the remission phase. So this data comes from Dr. Chardovetti's group at Johns Hopkins. They looked at their group of patients. About half of them had a below normal MTS level, but 70% is still a pretty high bar, and half of them had totally normal MTS13 levels. And they observed that some people who experienced strokes during their TTP remission, all of them belonged to the group of people with below normal MTS13 level. So this starts giving us the first hint of what can we do about this, which is perhaps raising the bar even higher to decide when we need to give immunosuppressive treatment, which right now we do, if IMTS13 is 20%, you're getting immunosuppressive treatment, we are preventing acute TTP relapses, that's great. But maybe we might need to raise the bar even higher to be able to prevent other complications, such as strokes. Now, I'm going to stretch out this topic a little bit to go beyond strokes and talk about the heart. So, the risk of heart problems, which we often refer to as cardiovascular diseases for the heart and the blood vessels, they often go hand in hand with the risk of strokes because ultimately it's all about the blood clot that is cutting off the oxygen supply to these critical organs. So diseases that increase the risk of stroke are also often associated with increased risk of heart attacks and cardiovascular diseases. So for example, the usual suspects: smoking, high blood pressure, uncontrolled diabetes, high cholesterol. None of these things are friends of your blood vessels, okay? Now the big question is TTP also here on this list? TTP also putting the rest of the cardiovascular system in danger. So we're going to take a step back again to talk about how we recognize when a person may be having a heart problem. And I put this picture here. This is like an illustration of a very famous, basically artist who drew some of the most popular anatomy books that we use in medical school. And he also has this book about clinical medicine. So he has this illustration, probably from the mid of last century, of a middle-aged white man clenching his chest and experiences excruciating acute heart pain. Okay, so this is the picture of what a heart attack looked like in people's mind and in physicians' minds for most of last century. But if you look around this room, a lot of us don't look like this, and yet heart attacks can also happen to us, unfortunately. So things that we need to, the most common presentation of heart attacks still are chest pains in both men and women, but it can also be shortness of breath, heart racing, or just simply fainting and collapsing could be the first manifestation. But certain groups of people may also there's more atypical symptoms, and that's where awareness and advocacy and being able to speak up for yourself or your loved ones is important because sometimes it's pressure or pain in the lower abdomen. It can be pain in the jaw, which is not very intuitive for most people, or even in your upper back. Not vomiting and breaking out in a cold sweat could also be a symptom of a heart attack. And indigestion. Now, okay, if you went to a Mexican restaurant last night like I did, not all indigestion is going to be a heart attack. There are more things that is making you think like, I'm not well. And indigestion is one of the symptoms. Listen to your own body. Okay, it's not because it's not heart pain that it couldn't be a heart problem. And extreme sense of fatigue sometimes people will report. All right, so back to the heart of the TTP survivors. Um, what we are learning as people are living longer and longer after their TTP episodes is that some of them will develop heart diseases. And these heart problems may develop earlier among TTP survivors than they would in the general people who don't have TTP. It is also true that we see a high number of people suffering from high blood pressure or having or smoking cigarettes after they have survived an episode of TTP. So there's what we call like a burden of risk factors that is present among our patients, among you. And what we're starting to learn, and Dr. Sukmar is doing a lot of work on this topic, is that this kind of classic risk factors for heart disease don't fully explain what's happening to lupus survivors. And now, just to make things more complicated, low ADMPS13 levels also don't seem to fully explain why we're observing these kinds of complications. So, what is happening? Okay, and before we talk about what we can do about it, okay, we established the problem. We want to know what we can do about it, but we need to understand why it's happening to be able to know where we start. So, we learned a lot about the mechanisms of TTP. And so I'd like to think of it in a scale, right, in a balance between the ADAMTS13 that is available and the von Willebrand factor that is the clotting factor that normally circulates in our blood. And they have to be in balance to keep the blood flowing in an appropriate manner and clotting when it's necessary. So in TTP, we know that the problem is that the ADAMTS13 is too low, and that keeps off this balance. But the question is, could the balance also be there? Could there also be imbalance because we are raising the von Willebrand factor levels? And what is it that could be driving this increase? So to think about what could the drivers be, we think of where substance is made. So ADMTS13 is largely made in the liver, largely at steady rates, um, while von Willebrand factor is also mostly made actually in the blood vessels of all places. And it's a highly dynamic regulation of how much von Willebrand factor is around. Sorry, did I stop everything? Okay. So the blood vessels, we used to think of them as glorified pipes, but it turns out that the blood vessels are actually a lot more than that. The blood vessels are a living and highly functional organ. So the lining of the blood vessels is what we call the endothelium, because we haven't heard any hard words this weekend, is the master coordinator of many important processes. Okay, so your blood keeps flowing in your blood vessels because you have an endothelium. Because if I take your blood and put it in a glass, it's going to clot immediately. It also coordinates how the blood or when the blood needs to clot. It is a master regulator of the immune response in our body. And it's very important for appropriate healing of wounds or tissue damage. So whenever you have something that is damaging or irritating the endothelium, you start seeing inappropriate blood clots, inappropriate activity of the immune system, and impaired healing. And again, the usual suspects are the things that we know are harmful for our blood vessels: the smoking, the high blood pressure, the diabetes. There's also less known things like chronic inflammation inflammation or this chronic abnormal activation of the immune system, and perhaps other factors that we still need to learn more about. And I should have listed here, pregnancy is a big, um, you know, thing that changes von Willebrand factor and is a known trigger of congenital and acquired CTP. So whatever raises your von Willebrand factor, whatever this driver may be, is throwing values further off between ADAMTS 13 and your policy. So now we have to think about what are we going to do? Why are people experiencing more heart attacks and strokes, and how are we going to prevent them? So specifically in PGP, this is an area of active investigation. I mean, it's very hard to improve over 98% survival, right? So now people are surviving the acute PGP, and we want to keep them as healthy as possible for as long as possible during their remission. So at Ohio State, we're very interested in looking at things like how well the blood vessels are working, about their health. And I know there's people in this room who have volunteered their time and participated in our research. So if you ever have an opportunity to participate in research on this topic, I would highly encourage you to do that. We and others are also looking into what is the role of inflammation and the immune system, the immune dysregulation in this chronic outcomes. So lots of work that we need to do that we need to do here. But the good news is that actually, in general, we know a lot about how to prevent cardiovascular disease. I mean that it's easy, but we know a lot about it. And I want to talk to you about some of the things that are certainly under your control. You can start acting on. So the American Heart Association has this very interesting program that is called Life Essential 8. And they kind of group these two essential aids in health behaviors: eat better, be more active, quit tobacco, get healthy sleep, and then health factors, including those things that we always talk about in our primary care doctor's office: managing your weight, your cholesterol, blood sugars, your blood pressure. So if you go to the American Heart Association website, they break it down, there's different interventions or factors, and give some tips and advice on how we can all do better on these domains. And I want to kind of delve into a few of them today. So probably one of the most common questions that I get, like across all the blood problems that I hear, is, Doctor, what can I eat or what should I not eat to try to make my numbers look better or not? And then when people ask me questions like this, I actually say, yes, there are things that you should be eating and things you should not be eating. So in the American Heart Association, they give us this little nice graph to remind us that our diet should largely be based on vegetables. Okay, plant-based diet doesn't mean everybody should be vegetarian, but there's a lot of wisdom to that. Um, Grains, carbohydrates that we're gonna eat should ideally be the least processed as possible. So always give preference to whole grains. When you're have to choose your cooking oils and how you're seasoning your food, try to choose the healthier oils. And olive oil is the one that we know works fast, but it can be hard to access. So there's some other oils that can be helpful as well, including fruit. Very important. I diagnose too many people with vitamin C deficiency because people are not eating fruit. Okay, and then they develop scurvy and show up bruising. Um, and then healthy proteins being the lean proteins, the fish, the poultry. Probably most of us have bacon for breakfast. Okay, so sometimes you can have a little bit of that, but just it's all about balance and drinking water rather than things that have added sugars to that. Now, physical activity recommendations. Okay, this is a big one. The standard recommendation is that we should all be doing at least 150 minutes of a moderate level of physical activity, something that makes your heart beat a little bit faster and make you breathe a little bit faster, or 75 minutes of a more vigorous activity, something that really makes you work out the sweat over spread throughout the week. But let's be honest, if I had 150 minutes to spare in my week, I would be doing so many amazing things right now. Okay, so how do we actually get this done? And I think one of the big secrets is start small and count the things that you're already doing and may not be paying attention to. Or try to sneak in more opportunities because even 5 minutes of physical activity here and there are going to build up to those 150 minutes. So, for example, if you have a dog, you can walk the dog or walk your kids or walk your husband, just go out for a walk and get people moving and just and take advantage of this time to have some good face time that doesn't involve screens, which is a whole other conversation. Do you need to take a phone call for work? Well, do that while you're walking down up and down the hall, or maybe even outside if you have nice weather. It's a great opportunity to be moving instead of sitting in front of the computer. Are you gonna be binging watching on your next favorite Netflix show? You can do that while you're on the treadmill or maybe lifting some weights or doing a little bit of uh, living room physical activity. If you have to commute to work, which it's such a time killer, but we have to do it, right? That's an opportunity to maybe park a little bit further out, a little bit further away, and maybe take a 10-minute walk to your office. I promise that this is highly unlikely to mess up your whole schedule for the day, okay? It's probably the time that you spend on Instagram. Um, Take the stairs whenever possible, okay? And of course, people have different um, opportunities and different abilities to be able to climb stairs for different reasons. But I challenge you today to at least go halfway to your room through the stairs as opposed to taking the elevators when you go back to your rooms, okay? And then you can try 10-minute workouts too, which are a lot easier to manage into your routine than an hour at the gym, okay? It's just never gonna happen. So you can squeeze in some physical activity like that too. And in the American Heart Association website, they have like this minute workout program. I will say though, if you've never done like squats and things like that, it can be dangerous. So, so if you've never exercised before, it's good to start with somebody that will teach you how to do the movements properly so you don't injure yourself, make things worse. And okay, this is the big elephant in the room. Yeah. I love that. Thank you for sharing. Yes, standing up as opposed to sitting down is a great way to get that little bit of movement. And my husband also has like something that looks like a little elliptical, like a mini elliptical that he's stuck under his desk. So he's like pedaling while taking Zoom calls. It's kind of interesting. So yes, thank you for that. But now the serious piece of conversation here. Okay, too many people in this room smoke. And this is the number one thing that we can do to keep ourselves healthy, not only from cardiovascular disease prevention, but from lung disease, from cancers, from the people around us that we may be exposing to cigarette smoking. And it's not only cigarette, we have more and more data coming out about things like smoking marijuana or e-cigarettes. Those are not good for our blood vessels either. So if you've never considered quit smoking, please give a thought about it this weekend. If you've tried multiple times, please know that the average person, the people in average have to try 8 times until they successfully quit smoking. And also know that your healthcare team can help you on this. So, and this is on us healthcare providers. We often don't ask people enough about what they are smoking or don't follow up with a question, when are you going to quit? So if your healthcare team is not starting the conversation, please make sure that you do, okay? This is major. So to summarize, um, the vital organs, some of the vital organs in our body may be damaged when blood clots interrupt the oxygen supply to these organs. Acute TTP clearly can cause some of this damage, strokes and heart injury. But TTP survivors are still not completely off the danger zone. And it's important that we um, learn how to recognize and also learn to advocate for us and our loved ones that it's not only middle-aged white men who develop heart attacks and strokes. Um, we are actively working on trying to understand how we can decrease this risk of the complications in the long run. But remember, there are true and tested ways to improve your cardiovascular health, and a lot of them are relatively inexpensive. You don't have to join the gym. Just be careful with the squats, and and they are under your control. Okay, they don't depend on prescription pills and side effects and things like that. So thank you all for your time, and I would love to hear more experiences about that, and happy to open the floor for discussion. Thank you. Yes.
Just related to the cholesterol-related stuff you were talking about, my daughter, who's she's on a med to presumably help suppress her immune system while she's in remission. But that med also causes her cholesterol sky high. Like, is that worth it, or like, how do you balance that?
Yes, the short answer is that it's probably worth it because the things that is more acute. Oh, yes, sure. So the question is, okay, cholesterol is important, but sometimes cholesterol can go up because of medications that we're using for immunosuppression. It's also true for steroids that can raise blood pressure and blood sugar. So how do we strike the best balance, right? So I would say if that's the immunosuppression that works for them, it's probably worth it because the more acute and more dangerous thing is the ADAMTS13 antibody coming back and triggering an acute episode of TTP. There are things that can be done in the diet to a certain extent to help with the cholesterol as well and physical activity. But if the numbers are elevated enough, sometimes there's a consideration about then cholesterol lowering medications, whether or not they could have a role. The younger people are, the less likely it is to make a big difference, but it's maybe more important for older folks. But definitely something to keep an eye on. So thanks for your question. Sorry. Oh, yes.
Basically, are you able to see? Okay, so even if you do an MRI of the brain and you don't see anything, I know for a fact, my son was born with a whole left eye not working, and he was born with, they basically said it was lymphoma. It was beyond lymphoma. So, okay, can you not, because sometimes you do not see it, or does it correct itself? How do you explain that? Is it because it's in the microvascular? Don't have seen it?
Yeah. So the question is, if I may summarize, how do we recognize when there has been a stroke or some kind of damage? Can we always see the blood clots, and how we can tell apart? So usually when we image the brain, we can see the damage that was caused by the stroke that happened before. Sometimes if people do things like a CT scan in the acute stroke time, you actually don't see anything. And then we only see the damage come afterwards. So the short answer is that we at some point can see the damage. We may miss it in the acute setting, but we usually see something in the imaging. The small blood vessels are often involved or damaged in TTP survivors, especially in the acute event. And we don't necessarily see those blood clots, but we kind of see the damage that they have caused eventually. Sorry, did you have a question? Yes, please.
I won't take long. This is your space. My name is Dr. Chaturvedi. I'm a hematologist at Johns Hopkins. And I just wanted to let you all know that, as Dr. Beltrami talked about, there is still much that we don't understand about how stroke and heart disease happens in TTP. But we have a lot of evidence that people with TTP may just have long-term, low-level inflammation that's hard to detect. We've studied this, we found that this is absolutely true, and we are opening a clinical trial. So if you're in the area and just want to talk about it, you don't have to participate, please connect with me or with Claire, who can connect you with me, because we are studying a drug called colchicine, which is an ancient drug. It was first used in 1550 BC. so 2,500 years old, and it was marketed 200 years ago. It's used for things like gout, it's used for pericarditis, which is kind of like an inflammation around the heart. But more recently, 2 years ago, the FDA approved it to prevent heart disease in people who are at high risk at a very, very low dose. It's called low dose colchicine. And we want to study the same low dose in people with TTP because their risk isn't measured the way everyone else's risk is measured, but our patients are clearly at higher risk. So if you want to chat about it, we can. Again, this is not pressure. It's just want you to know that this is available, and we're here to talk about it. Okay.
Thank you so much. Yes.
James with the Preventive Foundation. My question is talking a lot about health and very direct correlation between people who are more active, more healthy, so to speak, and TTP. So in other words, if you have a more healthy lifestyle, will you be less likely to develop?
Unfortunately, I don't think that we have evidence for that. The question is, if people keep a healthier lifestyle, are they at lower risk to develop TTP in the first place? And I think that, as perhaps many in this room may have experienced, perfectly healthy people may still develop these issues. And part of the problem is that there is a lot about the immune system that we don't fully understand yet, and why these imbalances in the immune system starts to begin with. But if you go into something like an episode of TTP being healthier, you're probably going to be better off in the long term and to endure all the treatments that are necessary and everything. But that's just my speculation. So,
Healthier after your first episode, will you have less chance of relapse or have less complications?
Yeah, so for the relapse question, I think the answer is probably doesn't make a whole lot of difference because, again, it's the immune system that is driving all of this. For the long